ACL surgery rehab is still frustrating for many patients. Number one, depends on the type of injury that they had to their knee, how acute it was, how swollen the knee was, how good their range of motion is, how good their mental and physical attributes go together, meaning are they an athlete in training or are they totally demoralized by their knee injury? So our goal is to help every patient see themselves as an athlete in training and not a patient in rehab, and use this window of time to focus on becoming fitter, faster, and stronger than they've been in years. So immediately after ACL surgery, we want to start on soft tissue massage and range of motion exercises to decrease the swelling and inflammation around the knee. Swelling and inflammation slows down healing and slows down the recovery. So all of the initial efforts are around swelling reduction and range of motion gain. Once that's achieved, we then can focus on muscle strengthening and balance and coordination, which we introduce into the rehab program very early so that the patient doesn't lose their sense of coordination and balance and accuracy, and then they can build on their strength once they have their athletic skills coming back.
So coming back from an ACL, it's always pretty an emotional experience for everyone. So really those first few days is kind of getting your mind wrapped around the fact that you are kind of in this process of healing for the next year. And then those first few weeks, just dealing with swelling, dealing with pain, quad atrophy, and getting neuromuscular control under your own kind of volition with quad sets, lots of range of motion, and then getting your gait down. So depending on kind of how serious the injury is or what else is involved with the ACL, usually your weight bearing is tolerated with crutches, and you want to use those crutches for the first couple weeks to get your gait mechanics right and controlled, and then phasing out of those crutches within the first couple weeks, as long as you don't have any pain or increase in swelling or increase in discomfort. And that's pretty much the goal for the first couple weeks. Just kind of getting your mind right, getting your body set up for success.
Hopefully we're starting to have you off crutches completely by that first, 1 week, 2 week mark, so that you're back to walking normally and moving and grooving. And then we kind of start into more of the functional things. So looking at squatting, stair navigation, picking up things off floor, starting to add a little bit more load through weights and dumbbells and things of that nature. So before surgery, a lot of people want to know kind of what that long-term process looks like, when they can get back to the things that are important to them. And obviously it's going to be different depending on what your specific goals are. Getting back to, being able to walk around with your kids and pick them up and do things like that, we can get you back faster in the first, month or two, versus the sports is going to take longer. So usually those are the questions that we get first, is kind of what their expectations are for the timeline. During the recovery, most people are asking, when can I do more? Most people are kind of chomping at the bit to get faster. And I always say, I love that with patients. I'd rather a patient that I have to rein in versus one that we have to kick forward. But that's our job, is to keep you safe.
Usually by 3 months, 2 to 3 months, we're starting to see that people can start handling a little bit more load, a little bit more weight on their body. And then from that 2 to 3 month mark into 6, 7, 8 months, you're really just trying to build strength overall in all areas, laterally, in forward planes, and more proprioception at that point. General sports, where a lot of clinicians are feeling more comfortable and seeing more success of the ACL recovery process, is getting closer to 8, 9, 10 months, even maybe a year, depending on what activity it is. If it's a more dynamic activity, soccer, football, cutting, pivoting, twisting, those are going to be closer to the year mark. And that's where we're seeing a lot more success of these ACLs just being happier, being stronger, and moving in a more successful direction.
There are naturally going to be highs and lows in recovery. Anyone who thinks that day one to, getting back to sports is a straight line, just never been through the recovery process. The highs and lows are natural. And so usually, having patients celebrate on small goals, so making kind of them short and attainable, and making sure that they see success, even if they're small successes throughout the recovery process, makes it a lot easier for patients to keep going, and makes, the bad days not as bad. The other thing that I think is really special about this place is all of our patients are always happy to talk to other patients. whether it's, the person sitting next to them on the other table, or if we've had someone who's gone through the same surgery, usually they're willing to reach out and communicate, which is a really great community I think this place has built.
Unfortunately, ACL rehabilitation still takes a long time, months, and we augment that healing now by the use of growth factors and injections of lubrication to help the joint heal faster and to help the patient recover in a way that returns them to their sports the way they'd like to be.